At the Interdisciplinary Conference on Spine and Leg Pain and Arm Pain that accompanies spinal stenosis, we will be discussing at length conservative treatment of patients. First of all, we know that the opioid epidemic, a study that was done, showed in New Hampshire that there was a marked lowering of the use of opioids in back pain when chiropractors were treating spine and radicular pain. Another study showed that the chemicals, there are certain chemicals produced around nerves when you have spine and radicular arm or leg pain, and we call that neuropathic pain. It has been found that there's been a drop in these chemical agents that cause back and leg pain with spinal manipulation. The impact of flare-ups. Patients that have, and realize that every year half of the people have a flare-up of their pain. Realize that people who go to an emergency room 1 year later still have the same pain. So there's a need for good correlative interdisciplinary care of back and extremity pain. The impact of these flare-ups interferes with people's activities of daily living. It results in a sense of disablement, changes in their mood. It results in their inability to cope properly with problems in life. And it comes from a lack of understanding of other people. Do you ever notice that people with back pain, some people somewhat shun them? They don't understand its ramifications unless they have experienced it. And again, the incidence of the contemplation or attempt of suicide in chronic back pain because of anxiety, fear avoidance, and the old adage of depression always sets in. We know that when we talk about studies, and this will come up in this interdisciplinary conference, that people have shown that there is no conclusion whether surgical or non-surgical treatment is best for people with lumbar spine stenosis. We do know that a 30% relief of symptoms is a good clinical outcome. I think people need to understand that, whether they are looking at a surgical or a non-surgical treatment. The conservative treatment for people who have had recurrent lumbar disc herniation, that is, they had surgery and recurrence, it is recommended in the literature that they undergo conservative treatment with the knowledge that if it did not work, surgery would always be another option. Another reason for this conference, the interdisciplinary discussion of different practitioners treating back pain as to when and how the best treatment should be involved. There was a study done showing improved outcomes of using a technique called flexion distraction manipulation in 6 weeks' time in relieving what's called neurogenic claudication, which are those cramp-like aching pains that you can get in your extremities, especially when walking, but some people even get at rest at night. We know that some of the drugs, the common anticonvulsives like pregabalin, gabapentin, literature shows they are no more effective than a placebo. This needs to be discussed in open forum. We know that a study was done in treating spinal stenosis with flexion distraction manipulation in which 73% of the people showed over 50% improvement of their symptomatology. So we know that there is a place for surgery in a very small number of people, but 99% of these people are going to need good, conservative, interdisciplinary, coordinated treatment so that the patient, when they have low back or leg pain, they know where to go, where to start, and that doctor be responsible for the total care. And we call that doctor a primary spine practitioner. This seminar, therefore, will cover for us and the public that we serve the algorithm of treatment, whether surgically, conservatively, and will cover the forms of care, especially non-surgically, in the treatment of back and extremity pain.